Hi, I'm Dr. Andrew Fetterman with RebuildDoc.com. Today we're going to go over your red light and cold light laser power wrap, how to utilize it and use it properly to make sure that you're getting the most effective treatments possible. So when you open up your box, you're going to have the wrap itself, and it comes with a power cord. This does plug into the wall, as you can see behind me. It does have a connector piece, so you're going to connect this first before plugging into the wall. You'll see a blue little light that shows that it's powered up, and you'll also hear an audible ding or powering up sound as you have that. You may wish to remove the protective coating. There are little blue tabs that are on each panel of the 6 panels that we have here. This combines red light and cold laser therapy, so different frequencies of light, so it can penetrate into the tissue to reduce inflammation, increase vasodilation, which is in expanding the blood vessels, so more blood flow and oxygen can get to the cells, and also it also stimulates blood vessel growth, or what we call angiogenesis. The majority of the time that we will prescribe this is to utilize it for your feet or your hands, but it can be used for chronic back pain, different other issues, autoimmune issues or inflammatory issues, osteoarthritis, arthritic pain, joint pain. It has a lot of applications besides what we're using for most of our patients with neuropathy. It comes with a remote that's going to need 2 AAA batteries. They are not provided, so please grab 2 AAA batteries because it works with the remote and the remote only. Put the batteries in. You have their display here, have a H, M, and L, high, medium, and low. We also have a power button, a timer button, and then a button here that shows that you can change the strength of this. The majority of the therapies we're going to do are going to be on high. If you feel that you're getting some sensations of burning or too much tingling, drop the intensity in the beginning and then build that up, and also consult with your doctor to make sure that you're utilizing the therapy correctly. What we're going to do, you have two choices, either continuous therapy for 4 minutes, which is what we normally use, or 8 minutes on and off so it can spread out the therapy. A lot of times we will utilize this multiple times in a day. Make sure you're at least doing 10 to 15 minutes in between sessions, because the fact is your body has to respond to what the laser therapy is doing. So to turn this on, we have our power button. For like most of our equipment, you need to hold the power button down to turn it on and hold it to turn it off. It's not a quick tap. If you think that's the case, it's not working, please hold the button down. As you can see with the 6 panels, what we have is also a Velcro strap that you're going to install to add to it so you can hold it in place when you're utilizing it in different areas of the body. For our intents and purposes that I'm going to demonstrate, we're going to put this on the feet. So as you can see, there is some level of flexibility with the panel. You do not stand on this. That will break the panel. So we're going to place it on the floor, and we're going to put our foot in it and let the panels drape over our feet. Most of the time we will be utilizing this for a 4-minute treatment. You can, if your feet are small enough, you can put both feet in to get the sensation and get the therapies and treatment. We can also utilize the same approach when we're doing this with our hands. Make sure that your shoes and socks are off and we're utilizing it with skin contact and your skin is exposed. You want to make sure that's the case, because the red light will not work properly and the lasers will not penetrate as deep if you're wearing anything over top, whether it be socks or gloves. So you'll be utilizing this care. Just to show you the other one, we can switch to hit the little timer button and we get a flashing with this in case the 4 minutes is too much of intensity for a continual treatment. You may wash this with a damp cloth. Do not use water or spray directly on it so it doesn't get into the unit. But what we usually say is like a damp cloth with mild soap just to clean it so you can keep the surface clean. And make sure you disinfect it regularly because you are touching it with skin on skin. If you have any other questions, feel free to reach out to me at relief@rebuilddoc.com. If not, enjoy your therapy.